Bismillahirrahmanirrahim. Thank you for joining me and thank you for asking this lecture to be in English. These are very simple lectures, usually divided into two parts. The first part is just anatomical landmarks that you are going to use it for the target volume delineation in breast cancer, mainly the lymph nodes, because it's easy to delineate the breast and it's easy to delineate the chest wall. So we are usually I just thought I will focus on the target volume delineation of the breast regional lymph nodes. And the first part, you just need to familiarize yourself with certain anatomical landmarks. And the second part, I'll give you a very simple method to delineate quickly all lymph nodes level in no time. These types of lecture is just for those who are going to start their rotation in breast cancer units, and when you go there you want like to familiarize yourself with the anatomy first so that you can help in target volume delineation and get your training quickly, and you get involved in your training quickly and do as much patients as much as you can. So the first step is that you familiarize yourself with some of the important anatomical landmarks that you are going to use it in target volume delineation. Let's start by the mediastinal window, CT axial view. We all know what we call it, the arch of the aorta, and with the arch of the aorta, the banana-shaped structure inside the chest wall, you cannot mistake it because you can see that it is below. There will be the heart, and then you follow the aorta till you get pulmonary artery. You can see it, and then the arch of the aorta will come in the upper part. This arch of the aorta will give us three main branches that you should, or you need to familiarize yourself with it. 1, 2, 3. The most left one will be the left subclavian, and the middle one will be the left common carotid, and then this one, or the last one on the right side, will be the brachiocephalic trunk. This brachiocephalic trunk will give us the right subclavian artery as well as the right common carotid artery, and this is the most important part, because we will need, or we will use the subclavian vessels, artery and veins in our target volume delineation. So the first step is to familiarize yourself with these three branches, and then maybe you can follow the left one to go upward, and then you will see what we call it, the arch of the subclavian artery. And this is very important in the target volume delineation, because we start our CTL4, or the supraclavicular region, just above the subclavian arch. So you have to familiarize yourself with the subclavian arch, and I'm insisting on saying artery because there is another arch that looks like pretty the same, and I will show it to you more anteriorly, and it is for the subclavian vein. But for the artery, you can never miss it, because you are following the artery from the arch of the aorta, and it is up to the subclavian. Then subclavian arch will appear. On the right side is very similar, but you just need to follow what we call it, the brachiocephalic trunk, because the brachiocephalic trunk on the right side will give us the subclavian artery. So if you scroll, and then you'll see that the subclavian artery is also coming from the brachial trunk, and again you will see the arch curving around the first rib, but this time will be on the right side. And again, you start your level 4, CTL4, just above the subclavian arch. This is the first step you need to know. The second step you need to know is when you follow this artery and it reach just crossing a line that will be between the first rib and the clavicle. You see this clavicle, this is the first rib. When the arteries start to move into just a space between the clavicle and the first rib. Here you start your level 3, so you need to familiarize yourself with 2 points for subclavian artery. One is just above the arch, or on the left side, if you see it on the left side, just above the arch. But again, from the coronal view, you can easily see the artery just crossing a line between the first rib and the clavicle, and at this point you will start your level 3 group of lymph nodes. So CTL4 will start above the subclavian artery, again artery, and level 3 will start when the artery cross a line between the clavicle and the first rib, between the clavicle and the first rib. Then you start your level 3. And this is the ESTRO guidelines. You have also the PROCAP guidelines. They are very similar in terms of following the artery. We have also the RTOG guidelines, but this time the RTOG is not following the vessels. It follows the anatomical landmarks, and we can talk about it later on. So we need to familiarize yourself with subclavian artery arch and where it crosses the rib and the first rib and the clavicle. This is a very important landmark. The second landmark, as I just mentioned, was about the subclavian vein. The subclavian vein is more anterior, as you can see here, and it will appear in the most anterior part of the coronal view, so you cannot see you cannot be very anterior like that and then imagine that this arch is a subclavian artery. So the subclavian vein is different from the subclavian artery being very anterior. The subclavian vein also will do another arch, but the second arch will be inside the mediastinum, because when the subclavian vein join the internal jugular vein, they will create what they call it the innominate vein, and the innominate vein on the left side will cross on the mediastinum. As you can see, I'm scrolling here, will cross the mediastinum to go to the superior vena cava, or to meet the right innominate to create what we call it the superior vena cava. So please don't mistake in between what I'm talking about in an arch inside the mediastinum, and this is the innominate crossing to the other side. As you can see, it's very easy to see. And don't also mistaken that the subclavian can make an arch, but this arch at this time will be very anterior. The relationship between the subclavian artery and subclavian vein, you need to be aware of it. You read in the text that the subclavian artery is cranial and posterior to the artery, or in other words, the vein will be caudal and ventral to the artery. And sometimes I get confused, how can the artery will be cranial at the same time it will be cranial and at the same time it is ventral. If you look at the sagittal view, this may explain it a bit. If I give you a point that it is, like, say, let's put the crosshair here, something like that. Don't forget about what we're looking at. But if I give you a point here and a second point somewhere here, this point, because of the sloping nature of our chest wall and neck, so you can see, this point is cranial, but at the same time it's posterior to the ventral part, or the posterior to the vein, or posterior to the sternum, so more posterior in terms of level. So you can have an artery that it is superior or cranial, but at the same time it is posterior because of the sloping nature of the body. And that's why what we are seeing here is that the vein in relation to the artery, it starts caudal, like below, but at the same time it's ventral, and that's the point. So when we look at the arch of the subclavian artery at this level, when I was talking about the subclavian artery and I was telling to you that this is the artery that we are going to follow, the idea is that at this level we don't have vein yet. The subclavian vein didn't appear yet because we are still high up. When we go down and ventrally, then the vein will start to appear. So you can imagine what's the relationship between the artery and the vein. The vein is caudal and ventral to the artery. So by covering the artery properly, you are covering the most upper, or you are covering the vein area in the most cranial part properly. And this is the idea. Covering the artery means that you are covering the vein. So if you take it 5 millimeter above the artery, you're not concerned about the artery, but you're main concerned about the vein. So you're covering the vein properly. So this is the first point we were talking about. So subclavian artery and subclavian vein, you need to be aware of it, and you need to understand where is it and how you can look at it. I would recommend that the first time you are using these scans, try to use a diagnostic scans, and try to use one with IV contrast, not like this one, because the IV contrast will make your life much easier. The second point I want you to be aware of, because you will read it inside the guidelines, is something called the thoracodorsal vessels. Thoracodorsal vessels. If you look at the area of the latissimus dorsi muscles or teres major muscles, just medial to in between the latissimus dorsi muscles and teres major muscle, there is a vessels or some vessels in the groove. And these vessels sometimes come more posteriorly, can be more posteriorly located. When you go for CTL1, they will tell you that, for example, if I'm just writing here CTL1, they will tell you that if you want to cover CTL1, or you want to draw CTL1, don't cover the thoracodorsal vessels. In short, they don't want you to dig inside this region. So you just do the area of level 1 will be something like that, but you just don't dig it inside. And this is difference between, I think, the RTUG and the estro. So if you look at the estro or the RTUG, this area was taken, but in the estro we don't take the thoracodorsal vessels, so we are just anterior to thoracodorsal vessels. So I want you to familiarize yourself with what I call it thoracodorsal vessels. And what I'm trying to say, what I'm trying to do now is to sensitize you from what you read in the table. So you need to read the table of the guidelines. I'm not here to give you the table or to read the guidelines for you, because it's easy for you to read the guidelines and get the atlas, CT atlases, and look at it. I'm trying to just make your mind a bit a bit systematic in terms of systematic in terms of what you have to look at and what to search for. This is the most important thing. I also need to familiarize yourself with what we call it the pectoralis major muscle. I don't think that any one of us or among us will not know that this is the pectoralis major, but this is not the point I want to show you. I want to show you this bit of tissue here. This is a pectoralis major, but don't forget that the pectoralis major has what we call it a clavicular head. So sometimes when you draw the level 3, you look at this and you don't know what is this exactly, and it comes in a very different way. So it comes like very thin, very strong, and very thick, so you don't know whether to take it or not. Usually we take it and cover the whole area, but some guidelines will do it like that. So you just understand that you should understand that this is what we call it the clavicular head of the pectoralis major muscle. Clavicular head of pectoralis major muscle. Just underneath the pectoralis major muscle, this will be the pectoralis minor muscle, and this is very important. I'd like you to know the origin of the pectoralis minor muscle. This is what we call it the coracoid process. So if you go very high up in the shoulder, you'll see this process called the coracoid process. And this coracoid process, we see it, by the way, in the X-ray, and this is what we call it the lateral border of the supraclav field. When we go for the supraclav field in the target volume delineation, and I will show you how do you place the fields anatomically. I will tell you that you can stop your lateral border just at the coracoid process or medial to the coracoid process. So this is very important landmark that you need to familiarize yourself with it. When you go to the coracoid process, you will see that the V-shaped muscles here start to appear in. This is the pectoralis minor muscle. The pectoralis minor muscle, if you go to the RTOG guidelines, they start level 2 and level 3 at the level of the pectoralis minor muscle. So this is a very important landmark for us if you are working with the RTOG guidelines. If you are using the ESTRO guidelines, you still want to know the pectoralis minor, because it is the lymph nodes in the interpectoral group will be between pectoralis major and pectoralis minor. This is number one. But the most important thing that you will talk, or the guidelines will talk about, the vein, the artery crossing the medial edge of the pectoralis minor muscle, where you have to start your level 2, and also it will be the end of level 2 when the artery crosses the medial edge of the pectoralis minor muscle. So the pectoralis minor muscle is very important. When you go down with the pectoralis muscle, you'll see that the space is vanishing, and the pectoralis muscle is going to attach or insert itself in the chest wall, and usually it goes to rib 3, 4, and 5. It's not important maybe to know the numbers of the rib, but it's very important to be aware of the pectoralis minor muscle. You will also see in the guidelines, and I think when you read the ESTRO, don't forget to read the modification happened in the ESTRO guidelines. So the first paper was published, but there was a modification happened that it's not, I don't know why it's not very famous, but when I talk about it, not everybody is aware of it. When you go to the modified version of the ESTRO guidelines, they were talking about a vessel called the lateral thoracic vessel, and this vessel here, they call it as the lateral edge of the breast tissue. But in the modification, they told us that if you can see the breast tissue well demarcated, and you can see that the breast configuration is very clear, you don't have to follow the vessels, because sometimes it's more posteriorly located than it should be. But it is something that you need to be aware of, something that I would like you to familiarize yourself with it. The last two things we need to talk about is what we call it the internal mammary vessels, which are the vessels, the two eyes, they can see just medial to the sternum, as you can see. And I wouldn't recommend that you search for the internal mammary vessels high up in the neck or low down when it disappears. So try to look at it in the middle, where you can see it very clear. Even without contrast, you can see clearly that the two dots there, and on the right side and on the left side, these are the internal mammary artery and internal mammary vein. Internal mammary artery is coming from the subclavian artery again. So looks how important is to familiarize yourself by the subclavian artery. Not only this, the subclavian artery, if you are working in head and neck, it will give you the thyrocervical trunk, which is part of level 5 when we go for the neck node leveling. So knowing the subclavian artery, or familiarize yourself with subclavian artery, I would highly recommend it. And there is a lot of videos on YouTube where you can see the branches, and you see how to look at it and where to find it. So I would recommend that you look at the subclavian artery and know exactly how many branches it has. So the internal mammary artery is coming from the subclavian artery still. Internal mammary vein will end into the innominate. And if we know that the veins usually are ventral and caudal to the artery, then these vessels will not follow each other when you go up. So when you go up in the very close to the origin of the vessels, you'll see that the vein will start to disappear whenever the innominate come into place. So the vein will end in the innominate, while the artery will go to its origin. So the two dots will end up by one dot, which means that the artery is continuing while the vein is not, because simply the artery is coming from the subclavian artery, is coming the internal mammary artery is coming from a higher point compared to the vein who left the artery to join the innominate. Do you understand what I'm saying? So when you go down and see two dots, don't be surprised that these dots will disappear and end up by one dot like that. Still, when you draw the internal mammary, as we will come to see it, we'll say that you take a 5 mm around it, but don't expect to see two dots. You will see only one dot because the internal mammary vein left the artery to join the innominate. And also, it's very important, being the artery on the right side, the subclavian artery on the right side is not at the same level on the left side. We just talked about the origin of the subclavian. One is coming from the brachiocephalic high up, and the second is coming directly from the left subclavian, from the arch of the aorta. So they are at different levels, and this will make the internal mammary delineation on the right side a bit different from the left side. So don't be surprised from that, but you need to familiarize yourself with that. And the last thing, anatomical point that you need to look at or to familiarize yourself with it, is a landmark called the fourth rib. The fourth rib is so easy to find, but we don't want the fourth rib to we don't want to follow the fourth rib in the in any point. We just wanted the fourth rib, or to localize the fourth rib at the level where the internal mammary vessels are located, so medial to the sternum. Is it correct? Yes. So if I look at the coronal view, we can count it easily. So 1, 2, 3, and 4. So this will be the fourth rib, but I don't want the fourth rib at this level. I want the fourth rib when it joins the sternum. So it's easy. What you have to do is to just click on the fourth rib. This is my fourth rib, and then just follow this rib when it joins the sternum. So when it joins the sternum, the rib, you just follow the rib till it joins the sternum. You can see it's moving, and when it joins the sternum, then click on it. This is where the fourth rib is. And what is the importance of the fourth rib? It says that we end our internal mammary chain lymph node just above the fourth rib. Clearly, this will not be the case if you have like internal mammary lymph node sitting around the fourth rib. So you need to take margin, maybe another space or so. So these are the landmarks that you need to know. So it's a fourth rib. It's easy to see. It's easy if you want to do it like the way I'm doing it. I'm counting it in coronal. So 1, 2, 3, 4. Here you are, and then go to the axial view, follow it till it join the sternum. And when it joins the sternum, this means that we are just above the fourth rib, which is, if you look at the sagittal view, then you know that you are in the right place. There is another way of doing things. Some are counting the rib one by one. So for example, if this is the first rib going to the sternum, then there will be the coming rib will be the second rib joining the sternum, and then this will be the third rib joining the sternum, and this will be the fourth rib joining the sternum, as if you're counting it one by one still. So it's up to you which way you want to do it. It's either you use a simple method of the coronal view and join it in the till join the sternum, 1, 2, 3, 4, and count it till you join the sternum and move it with it till you join the sternum, or you go from high up one by one. So we know that this is the clavicle, so this should be the first rib. So if this is the clavicle, then this should be the first rib. So wait for the first rib to join the sternum. So we're counting number 1. The next one to come to join the sternum will be number 2. The next one to come to join the sternum will be number 3, and then the next one will be number 4. And just put your cursor here and see that you just above. So 1, 2, 3, 4, just above the upper border of the fourth rib, and that's it. If you count it from the coronal view here, it will be a bit difficult because you cannot see except 1, 2, 3 spaces, which is fine, but you have to be in sometimes that this would not be the case, and you may see only 2 spaces, so it's a bit variable. So I would recommend that you start the fourth rib from the beginning. So what we said so far is nothing except to familiarize ourselves with subclavian artery, subclavian vein, thoracodorsal vessels, internal mammary vessels, pectoralis major, pectoralis minor, and finally the fourth rib. So the next will be to go and show you a very simple method of target volume delineation thereafter. So this will be the second part of the breast cancer delineation. Thank you.